A dual targeting scheme allows the ventilator to automatically switch between volume control and pressure control during a single inspiration. In this video, I'll provide two examples of modes that use dual targeting schemes. This is an example of two modes of ventilation that use dual targeting scheme. This is two screenshots from my mobile app, my ventilator mode map application. And what we see is the first screenshot on the left hand side of the screen with the Draeger V500. The mode volume control assist control pressure limited is actually uses a dual targeting scheme. If we look at the right side of the screen with McKay servo eye ventilator, the mode volume control also uses a dual targeting scheme. First, in Draeger ventilators, there's a lot of different ventilators that use the dual targeting scheme. And this is a screenshot from the Apollo anesthesia delivery system. And what you see here on the bottom left-hand portion of the screen, I'm going to highlight it with my highlighter, is a PMax setting. So it's not really a separate mode in the Apollo system, and in a couple Draeger ventilators also, where PMax is with the volume control modes. So it's an option one can turn on. The advantage of a dual targeting scheme, specifically pressure limited or the PMax, is that it can adjust to changing patient conditions and it ensures a peak inspiratory pressure. So with this slide, we see two examples here. The top of example is just traditional volume control CMV. And what we see, I'm going to use my highlighter here, is we're going to look at the pressure waveform. And what happens is the breath starts out, the breath's being delivered, and the patient starts coughing, or the patient's condition changes. This is a coughing patient actually. And what's happening is that the breath is prematurely ending, and this decreases my tidal volume significantly. The second example is actually volume control CMV pressure limited. So my PMax is set, and it's set at 40 centimeters of water. So we see kind of the same scenario as it's delivering a normal volume control breath, and the patient's lung condition changes. And what happens is it just limits that pressure, but it doesn't prematurely terminate the breath. The advantage of that is I can still get a decent tidal volume. So if you see me highlighting the tidal volume, it's much different than the 150 above. So this is one advantage of a dual targeting scheme. This is another example of a Draeger ventilator. This is the Oxylog 3000. And if we notice the settings down here, that what we have is actually a PMax setting. And this setting is a part of the dual targeting scheme. You can see the PMax setting actually in the measured value portion of the screen, and that this dotted line at 40 is where my PMax is set. This is my Oxylog Simulator, and let's see what happens when I change my PMax. I'm going to change it from 40 to 30, and we're going to look at the measured breath output. We'll look at the waveforms. And as you notice that my PMax, the line went down, my pressure limited line went down, and I'm going to change my patient to make it an asthma patient. And as you notice, I have alarm setting, my breath pattern change, have it squared off, so it changed to a pressure control breath. It didn't prematurely end the breath, it just changed the breathing pattern. As earlier mentioned, Draeger Avita series ventilators also have pressure limited mode on there also, or PMax. Now this is volume control CMV, as you see here. However, we go down here and look at the settings, we have no additional settings for our PMax. Now, even if you look under the additional settings, there is not a tab for my PMax. And this is most likely due to that it is not activated. So one would have to activate PMax as an option by the ventilator service settings in Draeger's ICU ventilators. So PMax, or pressure limited mode, is not used that much anymore in the ICU. One reason is probably due to the active exhalation valve. PMax has probably fallen out of favor due to that a lot of institutions now use volume control CMV with AutoFlow. And what AutoFlow does is actually turn the mode into an adaptive pressure control mode. So with any pressure mode in the ventilator, with the Draeger, what it does is it allows the exhalation valve to float. So here's an example of actually airway pressure release ventilation. And what you can see is someone actually breathing on top of the inspiratory phase. So now the exhalation valve, based on the pressure control setting, acts as kind of the PMax. So this is probably why it's fallen out of favor. However, accounts that use volume control ventilation as a primary mode all the time, they still use PMax. My second example of a mode that uses a dual targeting scheme is the volume control mode on the servo I ventilator. Now if we look at the settings down here, there is nothing to indicate that behind the scenes it has a dual targeting scheme. So unlike the Oxylog or Draeger anesthesia systems, there's not like a separate setting that tells the machine to either turn on or turn off the dual targeting scheme. This is all behind the scenes and the operator has no control. Now, how does the dual targeting scheme work in the servo I volume control mode? Now, here's a screenshot of an example of what happens. So if we look at this first waveform, this breath waveform, it looks like pretty much a normal volume control breath. I have a pressure rise, and then I actually have a little plateau here, and I have a constant flow waveform, and that's what we see with volume control ventilator. And volume control with the servo I is going to act this way in passive patients that are not spontaneously breathing. But as soon as the patient's inspiratory drive creates a 3 centimeter water drop, the breath changes. So what it does is it allows the patient to take a higher inspiratory flow, and that's what we're seeing with this second breath here. So I'm going to look at this second breath, and what happens is the patient is initiating actually the breath inside of breath. So we don't see it beforehand. We don't see a drop in pressure beforehand in the breath. We actually see drop in pressure or a pressure scooping during the inspiratory phase. And if we look at the flow waveform below that, allows the patient to get more flow. So it is changing the breath pattern from a volume control breath to more of a pressure control breath. And if this lasts long enough, flow is actually going to decelerate, and it's going to end the breath on flow criteria, much like a pressure support breath. So this additional flow that's added may lead to a higher tidal volume.